5:47 right now. This week we learned that a California woman is now believed to be the country's first coronavirus-related death. Patricia Dow died February 6th, weeks before the deadly outbreak at that nursing home in Washington State. Dr. Mark Kerner, ENT specialist with Dignity Health Northridge, is with us this morning. Dr. Kerner, thanks for joining us again. We appreciate it.
Good morning.
Good morning. We want to talk about how our understanding of the virus is changing based on what we know. The CDC now listing 9 possible symptoms before they were only identifying 3. So talk to us about that. And do we need to just be on the lookout for a couple of them, all of them? What do we need to watch out for here?
Sure. Now, this is a relatively new disease to us. So as it's evolving, we're now starting to see a number of different ways that it can present. So the initial 3 symptoms that we were all told about, that we all were looking for, were fever, cough, and shortness of breath. But now we know that at least 20-25% of the patients can present with loss of smell, loss of taste. We can see in kids, we're seeing a lot of conjunctivitis. That can be one of the presenting symptoms. It can, and now we're seeing that more than 50% don't have fever. So as it's starting to evolve, it's starting to look like a lot of the other viral infections that we're used to seeing.
And this is important because we may see that second wave, right, in the fall and the winter. So we just need to be aware of this.
Exactly. And what makes it difficult for us as physicians is understanding whether this is a typical influenza A or B, or if it's one of the metapneumoviruses or RSV or some of the other respiratory viruses that we're used to seeing, or is it the new COVID-19?
Right. And Dr. Kerner, there is new evidence suggesting that coronavirus may be causing sudden strokes in younger adults. I guess we wanted to start off by asking you, why is that?
Well, so we now know that as we're starting to understand the pathophysiology of the infection, we're seeing that it also affects the vasculature, both the small vessels and the large vessels. And when it affects those, it can create blood clots, and you can get diffuse clotting throughout the body, and that can result in clots even in large blood vessels in young people that can then result in a stroke.
And then we're seeing fewer 911 calls for emergencies like strokes and heart attacks, an indication likely that people are scared to go to hospitals. Can you weigh in on this and the danger in delaying seeking treatment?
Sure, absolutely. We're hearing about this all the time, that people that are having stroke symptoms, such as loss of use of one side of the body, or maybe a facial droop, or loss of sensation, things that we typically associate with a stroke, and that even most people understand that's something that's not good, are avoiding the emergency rooms or avoiding calling 911 because they're afraid that they may catch the virus or catch the disease in the local emergency rooms.
It's just so important that you get this taken care of so quickly. Dr. Kerner, we really want to appreciate you coming on with us this morning and sharing your expert insight. Dr. Kerner, an ENT specialist with Dignity Health Northridge. Stay safe and have a good weekend.
Great. Thanks to you, too.
Thank you.